Good morning, everybody. Can you please take your seat or retire to the hall for your conversations? Because we have serious business here today, and we need full attention by the audience and our members, of course. And as I promised last time, we're going to go and introduce, we're not long introductions, but we want something interesting out of all these members up here about themselves. But first, we're going to take roll, see who's here. Can the clerk open the roll, please? Thank you. Vote yes if you're here.
And if I'm not?
We'll be happy.
Okay, we have 20 members here. Congratulations, and thank you for attending this morning. So why don't we start on this side with the former chairman of the committee and my really close friend, Mr. Orrock.
Good morning. Thank you, Mr. Chairman. Delegate Bobby Orrock, representing half of Carolina and Spotsylvania, the south and southeastern part of Spotsylvania, and the western part of Caroline. Honored to be here. You want a fun fact of some descript? Fun fact. For those who may or may not know, I've actually been a radio disc jockey longer than I've been here. And feel free to tune in any Sunday morning. WFLS, you can pull it up online or on the computer. And every Sunday from 6 to 10, I host playing 4 hours of Southern gospel music. And I'd look much better there.
A face made for radio. Delegate Hodges.
Thank you, Mr. Chairman. Keith Hodges, representing the 68th District, which is Virginia's Middle Peninsula, so Gloucester, Matthews, Middlesex, King, Queen, Essex, and King William. I've been here since 2012, which was my first session. Actually, I was an independent pharmacist for 31 years, and I'm still practicing pharmacy and having fun and enjoy solving problems here in the General Assembly.
Thank you. Is that, I wondered what you were doing. Okay, Delegate Walker.
Good morning, Delegate Walker from the 52nd District, which is the city of Lynchburg and portions of Campbell County. Lynchburg is known affectionately as the Hill City, and we are the smart city because we have 3 private colleges and 1 just outside of the city. So please come visit us.
Thank you, Delegate. Delegate Cherry.
Spend your money and go.
Yeah. Delegate Mike Cherry, I represent the 74th House District, which is all of the city of Colonial Heights and parts of Chesterfield County. It is an absolute pleasure to be with you today. A little bit of a fun factoid: through my military service, I've set foot on 6 of the 7 continents in about 75 different countries.
Wow, okay, that is interesting. Yeah,
Good morning, everybody.
Scott.
Delegate Philip Scott here, represent the 63rd District, which is portions of Orange County and Spotsylvania County. A little fun fact, my first real job was a bell ringer for the Salvation Army.
Wow, okay.
Did he say real job?
I got paid for it.
And pharmacist number 2.
Thank you,
No, number 1 in my heart.
Thank you, Mr. Chair.
Wow.
And,
We know you get your drugs from.
Starting off fun today. My name is Otto Waxman. I represent the 83rd District. That includes the counties of Sussex, Greensville, Brunswick, Southampton, portions of Isle of Wight, portions of Dinwiddie, and the city of Emporia. As noted, I am a pharmacist. Grew up in a small community pharmacy, owned a small community pharmacy for 17 years, where I really enjoyed that. And healthcare is my passion, particularly provision of rural healthcare. Thank you.
Delegate Taylor.
Good morning, Kim Taylor, representing the 82nd District, which is a majority of Dinwiddie, City of Petersburg, Prince George, and Surrey County. And I am excited. My husband and I have been business owners and entrepreneurs for 20 years. Proud mom of a beautiful young woman. And I am much more fun in the afternoon, so I'll probably have a fun pack then.
Okay, noted. Delegate Higgins.
Delegate Gary Higgins, I represent the 30th District, which includes Western Loudoun and Western Fauquier counties. I do not have a radio show. However, I do look better on the radio, just as Delegate Orrock said he did. And I've been asked regularly if this is my best session, and I said, well, since it's my second session, could be my second best session. So we'll see, and
TBD.
it's a pleasure to be here. Thank you.
Delegate Owen.
Thank you, Mr. Chairman. David Owen, I represent the 57th District, which is Western Henrico and Eastern Goochland. Fortunately, we did not lose water a week ago. Fun fact for me, unknown fact, my father worked down here as a committee clerk for 25 years after he retired 40 years from the highway department. So that's my fun fact that probably people don't know about me. So thank you. Proud to be here and learning as I go. Thank you.
Thank you, as we all are. Delegate Singh.
Thank you, Mr. Chairman. My name is J.J. Singh from southeastern Loudoun County. Fun fact about me, I was a Peace Corps volunteer in Bolivia, lived at an altitude of 12,000 feet with no heat for 2.5 years. Then I ran in a special election, January 7th, where it was in the mid-20s with wind chills. So I was happy to walk here this morning with no jacket, and I feel totally fine. Thank you so much.
What is the elevation of Loudoun County? Okay, Delegate Gardner.
Yes, good morning. My name is Deborah Gardner, and I represent the 76th District, which is northern and eastern Chesterfield, and I only have one jurisdiction, and I'm really glad about that. Fun fact about me, I am working on my 3rd retirement.
Delegate Henson.
Good morning. I am Delegate Rosia A. Henson Jr. I represent House District 19, Fairfax and Prince William Route 1 corridor. Fun fact, I am in an Oscar-winning film.
Oh. Okay, we're going to leave that myth. Going to hang it. That is, okay. Come on. All right. Delegate Cole.
Good morning, everyone. I am Joshua Cole, representing the 65th House District, which is the entire city of Fredericksburg, northern Spotsylvania, and southern Stafford County. And my fun fact is I am the first cousin to Van McCoy, and that's why I'm always hustling.
Oh, okay.
Good morning. I'm Irene Shin. I represent the 8th District, which is entirely inside Fairfax County, includes the town of Herndon, Chantilly, and parts of Fair Oaks. A fun fact. Is it a fun fact that people go to Delegate Tran's office to have meetings with me to lobby on a bill and then leave the office thinking they've lobbied me, and I was like, I have no idea what this bill is. That's a fun fact.
Thank you, Delegate Shin. Delegate Herring.
Good morning, Mr. Chair and everyone.
Okay. All right. Order in the court.
Good morning, everyone. I'm Charnel Herring. I represent the 4th House District, which is Alexandria City and parts of Fairfax County. My fun fact is ever since the age of 3, dance has been a part of my life, from dancing with Virginia Ballet, School and Company, to choreographing for musicals, and still dance and take dance classes today. That's my fun fact.
Good morning. Rodney Willett, representing the 58th District, which is most of Western Henrico. It's great to be with you. I will share my fun fact that I started my career actually as a professional photographer, so I'm more comfortable being on that side of the camera versus this side of the camera. I did photograph the General Assembly back in the early 80s, and I will not name the members who were still here, who I photographed then.
One of them's sitting down beside me here.
I didn't say that. I didn't say that. Thank you.
Delegate Hayes.
Good morning, everyone. I'm Delegate Cliff Hayes, representing the 91st District, which is a part of Chesapeake and Portsmouth. And my fun fact is that I played baseball in college at Norfolk State University. I was an infielder, and we had much success there. Out of 4 seasons, we won 3 conference championships. Behold, the green and gold.
Delegate Price.
Good morning. I'm Delegate Sia Price. I represent the 85th District, which is parts of Newport News. I attended 3 HBCUs. That's my fun fact. And also, this is my 10th session. And I love that everyone just said, no, really? It doesn't look like that.
That wasn't a fun fact.
Delegate. I'm Delegate Patrick Hope. I represent Arlington County, but I'm going to be funny too because it's not my fun fact. It's not something I've done in the past. It's something I'm going to do in the future. I'm going to be convicted of murder for killing the chair for putting the entire committee in this audience through this exercise.
Good morning. I'm Kathy Tran. I represent the 18th House District, which are the communities primarily to the west and south of the Mixing Bowl. So if you're passing through I-95, 495, 395, that's my community. About 1 in 5 people in the 18th House District rely on Medicaid for their health insurance. My fun fact is when I was my fall freshman semester, I was a coxswain on our crew team for college.
At Duke University, yeah.
Part of the ACC people.
Yes, and I'm an ACC guy too, as everybody knows, but my name is Mark Sickles, and Delegate Tran and Delegate Herring are my neighbors up in Northern Virginia. My district is all within Fairfax County, and my fun fact is, I want the Family Foundation guys to perk up here. My fun fact is that I wouldn't be here if it wasn't for Billy Graham, because my parents met singing in the choir at the 1952 crusade in Washington, D.C. Yeah, they were both pretty good singers. Okay, now let's get serious. We have a couple of administrative items to point out here. To get past. And the first one is HB 1629. We need to refer that bill to the Courts Committee.
So move.
Second.
Okay, it's been moved and seconded that we refer to courts. All in favor say aye.
Aye.
Any opposition? Okay, hearing none, it's so referred. And also HB 2088, Delegate Shin's bill, also a courts bill in nature, and we also need to refer that to courts.
So move.
It's been moved and seconded that we refer HB 2088 to courts. All in favor say aye. Any opposition? Hearing none, it is so referred. Okay, we've got a couple bills we're taking up at full committee. These are intended to be bills that are not controversial. If there is any controversy that arises, we will re-refer them to one of our subcommittees for inspection and detailed look at them. The first one is Delegate Waxman's HB 1582. Delegate Waxman.
Thank you, Mr. Chair. Can y'all hear me?
Oh, please proceed.
I'm sorry?
Please proceed.
Okay.
Name all those counties you represent again.
I couldn't tell if the mic was on or not. House Bill 1582 is about a collaborative practice agreement. This is already in existence where a physician or nurse practitioner or so forth can go into an agreement with the pharmacist, and it said that they could implement drug therapy. One of the things that we'd like to do is in Southwest Virginia, there's a pharmacist that wants to do a substance abuse clinic at Korean. They're all in favor for this. The problem is he can't write the prescription right now because Suboxone that they use is a controlled substance. DEA does not recognize the word implement therapy. So we want to do with prescribing, and I just realized that we do have an amendment for this bill. The amendment is on line 35. After the word prescribing, we strikes the words for the implementation, just to clear up the language. And also we realize that you have a pharmacist prescribing now, and that later on the section talks about the prescriber. That gets really confusing. Are we talking about the pharmacist or the one that is actually issuing the collaborative practice agreement? So on line 37, after we strike the word prescriber, and we list those prescribers that can manage the collaborative practice agreement. And unfortunately, we have an amendment to the amendment because we realized we left one out. It should say the words licensed physician, comma, podiatrist. We accidentally left podiatrist out. Advanced practice registered nurse or physician assistant. So If I could, somebody could move to accept that amendment, I would appreciate it.
Second.
Been moved and seconded to accept these 3.5-line amendments. All in favor, say aye. Aye.
Okay, so basically now the purpose of the bill is just to replace the word implement with the word prescribing. So DEA hopefully will recognize that and issue a DEA license for the pharmacist to prescribe Suboxone to move forward with the clinic. I do have a letter of support from the physician, from the pharmacist Korean, and also we've heard from the Steve Herrick at the Director of Health Services with the Department of Correction. They would also like to make sure that this is done for similar reasons with DOC.
Okay, terrific. Do any members of the committee have any questions for the delegate? Is there anyone in the audience who would like to speak for the bill? Okay, everybody's happy. Anyone want to speak against the bill? No unhappy people? Okay, it's been moved to report and it's seconded as amended. Clerk, please open the roll. Can you stay there, Delegate Waxman? Oh, yeah, sure. Go ahead. Okay, HB 1587 is the annual bill where we add things to the list of no-nos.
Yes, sir.
Could you explain?
Yes, sir.
The bill?
1587, like the chairman said, it's an annual bill. Each year, there are new drugs that are created, invented, or new illicit drugs that come onto the market. The DEA will schedule those based upon if there are abusive or not, if they're for a legitimate medical purpose. The ones that have no legitimate medical purposes are Schedule 1. That's the most tightly controlled, and then it goes up to Schedule 5 that are less abusive but have a medical purpose. DEA puts those on the list. Virginia honors those for a period of, I think, 18 months, but it has to, this body has to permanently adopt that into the code so it becomes the same schedule, just consistent. We're making the state schedules consistent with the federal language.
Thank you. This will be the 22nd year that I voted on a bill like this. Any questions from members of the committee? Anyone oppose any of these drugs that are going to go on this list? We didn't give anyone in the audience a chance. Is there anyone out there not like this list? Okay, very good. It's been moved and seconded. Clerk, please open the roll. And thank you. The bill passes on a vote of 22-0.
Thank you, Mr. Chair.
You're welcome. You're welcome. Delegate Price, can you tell us about HB 1716? Thank you.
Yes, thank you, Mr. Chair. I think he's right. I'm not sure if the mic is on. But, so maybe not in line with your comment about non-controversial, but in line with having heard this legislation before. I do appreciate being heard in full committee. But HB 1716 is the Virginia Right to Contraception Act, and the language is the same as passed out of the General Assembly last year. This bill would codify a person's right to contraception by preventing any state or local actor from infringing upon an individual's right to access contraception. The language of the bill includes various types of FDA-approved medicines and devices so that people can access them to prevent pregnancy and also help treat other issues like endometriosis and polycystic ovarian syndrome. Last year, we heard this bill is not needed because there is already access to contraception. But Mr. Chair, I would like to point out that since last year, even more lawmakers on federal and state levels have mentioned that contraception was something that they were interested in looking into. So the hundreds of thousands of Virginians like me that are dependent upon this medicine in consultation with our healthcare providers would love for it to be protected here in Virginia. I have more, but I will stop there in the interest of time.
Thank you, Delegate. Are there questions from the committee first before we turn to the audience? Any questions? Okay. You can hit your request to speak button if you'd like to speak. So first, let's ask the audience if there's any supporters of this bill that would like to testify in favor of HB 1716. please welcome and tell us who you are again, even though most of us know
Good
you.
morning, members of the chairman, members of the committee. I'm Nicole Lauder. I represent the American College of Obstetricians and Gynecologists, OBGYNs. We are fully in support of this legislation. Thank the patron for it. And as she said, the threat of access to contraception is definitely real, and we appreciate you codifying this if passed. Thank you.
Thank you. Thank you. Welcome. Please introduce yourself.
Thank you so much, Mr. Chair, members of the committee. My name is LaTwyla Mathias, the Executive Director of Progress Virginia, and we fully support this bill and thank the patron for bringing it. Our personal decisions are our decisions, and we think that this bill reflects that. Thank you so much.
Thank you. Please come forward and introduce yourself.
Hello, thank you, Mr. Chair, and to this committee for allowing me the opportunity to speak. I am Dr. Avanti Jayavira. I'm with the Reproductive Health Access Project. I'm here to represent this organization and myself. I just want to say that when we're talking about contraception, I want it to be clear that this is also a treatment option for many different medical conditions. I have several patients who have different types of autoimmune conditions, and being on a long-acting contraception can help actually stabilize their condition. We're also talking about cardiovascular conditions, neurological conditions, where contraception preventing pregnancy is a way to keep their illness, their chronic illnesses at bay and controlled. And so whenever we're talking about this, I also wanted to be clear that this is a treatment option. It's a type of medication. I need to be allowed to perform my job. I need to be able to practice medicine without any kind of interference, because in that visit, the patient is my utmost priority, and it's important for me to be able to provide all of their options, and that conversation should just be between me and the patient. Thank you so much for your time.
Thank you for coming this morning. Please come forward and introduce yourself.
Hi, my name is Shukufa Dianat. I'm a family physician here in Richmond, Virginia, and I'm here to speak in support of the bill. Thank you so much for bringing it forth. In the last year, I've had many young people come to me asking for tubal ligations or vasectomies because they are terrified that contraception will go away and they will not be able to access it. So I ask you to please let us continue and protect this very important thing that's important for individuals and their families and their communities. Thank you.
Thank you very much. Good morning. Please come forward.
Good morning. My name is Raina Han. I'm a medical student here speaking on behalf of the Reproductive Health Access Project and myself in support of this bill. As a medical student, I learn a lot, and one of the things that I learn about is how important contraception is in the care of patients, as the delegate mentioned, in treatments of endometriosis, PCOS, and other treatments. As somebody who has taken the oath to do no harm, it is important for me to be able to have these access to these treatment options so my patients can make the best decisions for themselves, and I can provide the best care for them. Thank you.
Thank you. Thank you. Please come forward.
Hi. Good morning. My name is Sriya Kongla. I'm also a medical student as a representative here on behalf of the Reproductive Health Access Project. But this morning, I'm not speaking to you as a medical student. I'm speaking to you as a daughter. When I was born, my mother was incidentally found to have an ovarian tumor that had to be removed. And following that incident, she was prescribed oral contraception medication as a way to help protect her health and make sure that there was no recurrence of that tumor. So I'm here today to emphasize how important it is that these treatments are not only they're evidence-based medicines that can help protect lives and help protect and keep together families as well. So thank you.
Thank you for coming this morning. Please come down.
Hello, good morning. My name is Precious Afadu. I am currently just a worker at a clinic. I've got a degree in social work, but I started working at this clinic because I met this doctor who's been really helpful to me, and I constantly meet patients who are having so many problems and need care, and currently patients are having to be flown in from different places to get access to care just because of how the laws are currently being stated and acting and affecting people. So I really hope that we can, agree on this and keep contraception available to everybody because everyone needs it for different reasons, and it shouldn't be too hard or a problem to be able to get care.
Thank you. Thank you for coming. Okay, are there any people who would like to speak against the measure? Good morning. Please introduce yourself and
Good morning, Mr. Chairman, members of the committee. Jeff Caruso with the Virginia Catholic Conference. And I think you're familiar with our opposition to this bill from last year, so I'll be brief. I just want to give a few very brief comments about our concerns. First, the legislation, person is not limited to adults, so it does include minors. Secondly, the bill's cited definition of healthcare provider includes pharmacists, dentists, optometrists, podiatrists, chiropractors, physical therapists, psychologists, social workers, marriage and family therapists, and others. So therefore, the bill would allow a minor to bypass a physician and get contraceptives directly from a pharmacist, or at least theoretically, even from a dentist, an optometrist, a social worker, or any of the other professionals that's listed in the bill's cited definition. So this is in contradiction to current law in Virginia. Also, since the word contraception defined in the bill is to include the use of sterilization procedures, the legislation would even give minors a right to be sterilized, thus undercutting current law on parental consent before a minor can have a surgical procedure. And then finally, the legislation would also, we think, undermine the religious liberty and conscience rights of hospitals and health clinics, some of which could not provide, for example, sterilizations or emergency contraceptives. So for all these reasons, we think this is a sweepingly broad bill. We'd ask you to take a very close look at it and to oppose it. Thank you.
Dr. Price, we have 3 speakers that are online that we're going to call on now. And I think these are probably in support of the legislation. Ms. Lockhart, are you out there? Would you?
Yes. Good morning, Chair, members of the committee. Jamie Lockhart, Executive Director, Planned Parenthood Advocates of Virginia. We are in strong support. Thank you, Delegate Price.
Thank you. And Ms. Kendra Sutton-L. Welcome.
Good morning,
hit your mute. Okay.
Mr. Chair and members of the committee. I am the Executive Director of Birth in Color, and we are in support of this bill.
Thank you. And finally, Patricia Heyer. Ms. Heyer.
Yes, good morning. I'm Patricia Heyer. I'm a resident of Blacksburg, Virginia, but today I'm speaking on behalf of the League of Women Voters of Virginia. The League supports this bill. We believe contraceptives should be accessible to all. The bill assures individuals the right to obtain and use contraceptives and protects healthcare workers and others who assist in providing contraception. Most importantly, it ensures that the Commonwealth and localities cannot interfere with this guaranteed access to contraception. We support this bill and we hope you vote for it. Thank you.
Thank you for joining us this morning. Okay, committee members, are there any further questions of the patron?
Mr. Speaker.
Yeah, I'm going to ask you for summary remarks, but see if anyone wants to ask any questions. I see none. It's time to sum up if you'd like to.
Yeah, no, I just wanted to.
Home. Okay.
Just speaking to the bill.
Yeah, sure.
Thank you, Mr. Chairman. Just speaking to the bill. I do have concerns with this. You know, as a pharmacist, for many, many years, I've dispensed contraceptives. It's what I do each and every day. But I do have concerns about this. First, there are no boundaries to age with this legislation. It doesn't specify age limits, which really undermines parental authority. And minors can access contraceptives without parental consent, leading to really, when I look at this, diminished parental involvement in critical health and moral decisions. Secondly, I do have concerns regarding provider discretion. So this really allows patients to demand specific contraceptives. So for instance, a patient will go into a physician's office, demand an oral contraceptive. They may have underlying conditions, obesity, smoking, history of thrombosis. You know, that can lead to blood clots and cause major problems, but yet they can demand that of the physician, and the physician has to comply. And I do have major concerns with that. So for those reasons, Mr. Chairman, I'll be voting against the bill.
Okay, thank you. Anyone else before Delegate Price sums up? Okay.
Yes, thank you, Mr. Chairman. I was actually hoping that the gentleman, after having been fact-checked in a local paper, would have not brought those same concerns forward this year, but I will fact-check again. So this bill does not change anything about the current legal framework that is already in place where minors have the ability to make certain reproductive health care decisions without parental consent. This does not touch that. We do not restate current law in every single bill that we bring forward. We allow for existing code to speak for itself. The same with any of the religious exemptions. Those are handled already, don't need to be put into this bill. The other part that I would say is that while providers can definitely have their feelings, this has nothing to do with providers. This is saying no state or locality shall take action to impede upon access. And so a pharmacist is not a state or a locality, Mr. Chair. And so I am really hoping that we won't have to go through this again on the floor, but I will be prepared to do that again as many times as needed so that there is a fact check in the ether.
Okay.
I'd like to move to report.
Second. Okay, it's been properly moved and seconded that we report the bill. Is there any further discussion on the motion? Okay, clerk, please open the roll. And the bill reports to the floor on a vote of 15-7. Thank you, members. Thank you, Delegate Price. Okay, waiting patiently on the front row is one of my good friends, Delegate Sullivan, with 1782. And if this bill were to pass, it would need to be referred to Appropriations Committee, which is obvious. Thank you.
Thank you, Mr. Chair. Mr. Chair, members of the committee, HB 1782 is brought to me by the rare disease community. And for many, many years in the United States, nearly every newborn has been screened for a wide range of conditions that, in many cases, if left untreated, can cause disabilities, developmental delays, serious illness, or even death. Virginia's newborn screening program is a partnership between the Virginia Division of Consolidated Laboratory Services and VDH, and it performs more than 4 million newborn screening tests a year. The RUSP, which is the Recommended Newborn Screening Panel, is a list of 38 disorders developed by U.S. Advisory Committee and the Secretary of Health and Human Services. And then new conditions get nominated to be put on the RUSP by organizations and are then added to it after a science-driven, evidence-based review process. This bill would do three things. Require Virginia to automatically consider screening newborns for any disorder that's on the RUSP and remove, therefore, the burden on patient communities to initiate the process. Require the Department of Health to evaluate a disorder's inclusion within 12 months and implement testing within 36. And then ensure resources are available to facilitate the new addition of new disorders. So this is not based on any sort of complaint about the current state process. It's mostly simply codifies the existing process and ensures transparency and a clear pathway. Mr. Chair, my dear friend, when I walked in the room this morning, I thought I had peace in the valley. But about 5 minutes into the hearing...
We're going to find out.
Yeah, about 5 minutes into the hearing, I learned that VDH has some comments.
Oh, okay.
So I'm mindful of a conversation we had and of what you said at the beginning of the hearing. I think I can represent, I think they're here, that we're the committee to pass the bill rather than trying to, I didn't have time to negotiate anything. VDH we will continue that conversation, whether before an appropriations meeting or for that matter, if it were to ever get to the Senate. So there's time to deal.
We have a little time here, so why don't we find out what people think. How about the members? Do we have a question from the panel before we ask the members of the public to comment on this bill, 1782? Okay, Delegate Henson.
Thank you, Mr. Chair. I just have a question. Just to confirm, the way the bill reads is just asking the department to determine annually if whether disorders not included in the Commonwealth newborn screening should be reevaluated, correct?
I'm sorry, Mr. Chair, could you repeat the question?
Yes. The way the bill reads is just asking the department to determine whether disorders not included in the Commonwealth's newborn screening program should be reevaluated for inclusion, correct?
Mr. Chairman, that's correct.
Okay.
No further questions.
Okay, good. So why don't we ask the audience, is there anybody here that supports this bill? Welcome and introduce yourself, please.
Good morning, and thank you for the opportunity to speak with you today. My name is Dylan Simon. I'm here speaking in support, and I want to thank you for the opportunity to voice my support this morning. I work with the Everlife Foundation for Rare Diseases. We're a nonprofit organization that focuses on the development of and access to rare disease therapeutics, diagnostics, and cures, and we're here in strong support of the current bill. We want to thank Delegate Sullivan, VDH, and the Virginia Hospital Association for the work on this bill. We look forward to continuing to work with the delegate and other partners to continue to move this bill forward and ensure the fact that we can continue to bring early diagnosis for so many of the rare disease community. Similar legislation has passed in 12 other states and ensures the fact that early diagnosis is provided to members of the rare disease community to ensure the fact that they have access to life-saving treatment options. Thank you so much for your time.
Thank you for coming. Mr. Rawlings, welcome back.
Good morning, Mr. Chair, members of the committee. Brent Rawlings, Virginia Hospital Healthcare Association. We support the legislation and appreciate Delegate Sullivan bringing it forward. We're doing fun facts this morning. So a fun fact is that, if you may not know, the costs of the newborn screening program are paid by fees, or covered by fees, which are paid by healthcare providers. And just to give you some context, the last two disorders that were added to the panel, SMA and XALD in 2020, cost $1.5 million and $1.25 million respectively, increasing the fee from $101 to $138. And this is for each birth that occurs in the Commonwealth. Overall, about $11 million in fees are paid annually by hospitals. And so with part of that, and part and parcel to that, it's very important that the conditions that are included on the panel are covered under that RUS panel that's addressed in this legislation. A lot of work goes into reviewing these conditions and making sure that that is an appropriate test to include. And also, we also find it important that the advisory council that's established under regulation now have a role in reviewing those conditions before adding it to the panel, which is the current practice. And as Delegate Sullivan said, this just codifies that practice. So we're very supportive of legislation and is happy to answer any questions you have. And
thank you so much.
Thank you.
Okay. Is there anyone in the audience who has concerns about this bill? Pardon me? Oh, wait, whoa, folks. So I have people online. Yeah. I just have one person left online. Mr. Weber. Mr. Weber, welcome.
Yes. Thank you, Mr. Chairman. I really appreciate the opportunity to be here today. Speaking in support of House Bill 1782 and speaking as a parent of a daughter, a beautiful 3-year-old with spinal muscular atrophy, as mentioned, one of those rare diseases added to the panel. Unfortunately for us, I'm speaking on behalf of one of the cases that was just barely missed. Our daughter was born in January 2022, 2 months before the newborn screening panel in Virginia added spinal muscular atrophy. Spinal muscular atrophy is one of those rare genetic diseases where fortunately there is an FDA-approved treatment that's revolutionary. However, early detection and treatment is measured in hours, days, and weeks rather than months. We discovered she had SMA via symptoms when she was 4.5 months old. We've diagnosed her through a kind of a process of elimination with parents online. And found SMA. And we're heartbroken when we found out that SMA, despite listed as a treated or a covered newborn screening panel disease at the time, we've found the governor's press release dated in the interim that, made it very clear that she had not been treated. She's been treated now, and we're fortunate that, life looks very different. She's with us today. Prior to treatment, SMA was largely a terminal disease with most children not living past their 2nd birthday, and she's exceeded that greatly. But life looks very different. We had the pleasure of getting to know others in the SMA community, including some parents of kids who were born after the newborn screening and you can't differentiate them from the crowd. They're living life without fear of respiratory diseases, hospitalizations, and running around, where we have to deal with the challenges of a daughter who is going to be in a wheelchair likely for the remainder of her life and faces increased risk for respiratory disease, hospitalization, and so on. So speaking on behalf and strong support of this bill, plainly put, if she'd have been born in 41 other states at the time of her birth, she would have been treated. And unfortunately, Virginia was just a step behind. Science shouldn't be is the challenging part, and innovation is great. Looking forward to supporting a bill that aligns the policy to get a more straightforward alignment for the rare diseases that treatments are emerging today. Thank you.
Yeah, thank you so much for sharing that story. We had a motion to report and a second, I think. And is there any discussion, report and refer to appropriations? Is there any further discussion on the motion? Okay, let's vote. Clerk, please open the roll. And the bill passes on a vote of 22-0 to report and refer to appropriations. We'll see you upstairs, Delegate Sullivan.
Thank you, Mr. Chairman, members of the committee.
Okay. So is there any other business that a member would like to bring before us today? If not, the committee is adjourned.